The stem cell transplant activity, whether autologous or allogenic, continues to grow worldwide despite the advent of new drugs, highly effective. And in the field of auto-transplant, let's say for myeloma, it's quite amazing that actually we have a lot of new drugs, but they are not replacing auto-transplant. Actually, they are proving to be highly effective in combination with auto-transplant. And if you want to achieve a successful, efficient, and safe auto-transplant, you need to obtain a good graft, a good autologous graft. Historically, for more than 20 years, we've been using in general two major methods for mobilizing stem cells, either steady state mobilization with GCSF alone or chemotherapy-based mobilization using mainly high-dose cyclophosphamide plus GCSF. And there was a sort of a historical belief that the chemotherapy-based mobilization can be useful because beside mobilizing the stem cells, it can allow you to provide some more disease control thanks to the chemotherapy. However, today, I believe the field, the overall landscape is moving away from chemotherapy-based mobilization. Obviously, in situations like lymphoma, where anyway you need the chemotherapy, then it's okay. One can just do the mobilization in combination with the chemotherapy. But in situations where the chemotherapy is not mandatory, we have today a lot of evidence suggesting that we can move away from the chemotherapy-based mobilization. Because, and there are a lot of data highlighting that chemotherapy-based mobilization is associated with a lot of complications, infections, neutropenia, need for hospitalization, need for transfusions. All of this is impacting the quality of life of the patient. And at the end of the day, even if the chemotherapy drugs, the traditional chemotherapy drugs may be viewed as not very expensive, but still, when you add all of these complications together, actually you will increase the cost. Of course, we have also to acknowledge that the chemotherapy-based mobilization has a very poor predictability of the kinetics of mobilization. It's very difficult to know when you should start your mobilization. And this is why now with cytokine-based mobilization, with the introduction in many places of the wider use of plerixafor, actually you can achieve a very safe, quick, and reliable stem cell mobilization process. Because when it comes to cytokine-based mobilization, predictability is great. In terms of safety, you do not have all the problems you can encounter with chemotherapy-based mobilization. And most importantly, actually, the evidence is clearly in favor, showing actually that you can obtain a rich graft. And this is of great importance, the richness of the graft. Traditionally, historically, we've been living with this famous 2 million, CD34 positive cells per kilogram recipient body weight. However, we know very well that actually we should not target the minimum only, we should target the optimal number. And the optimal number, according to the results of different trials, is roughly between 5 and 10 million, because these are the numbers that would allow you a quicker, for example, engraftment in terms of neutrophil, and the consequences in terms of using antibiotics, in terms of febrile neutropenia, in terms of hospitalization, but also in terms of platelets recovery and decreasing the need for platelets transfusion, which can happen over several weeks after autotransplant. And beside all of these medical aspects, we do have also evidence showing that when using cytokine-based mobilization, especially the combination of GCSF and plerixafor, you can actually optimize the use of your resources, because we do have, and we published this a couple of years ago, the plerixafor era and the pre-plerixafor era. When you compare, for example, you decrease significantly the number of apheresis sessions, and this is really a great news for the organization of your apheresis facility, but also you decrease the time needed to perform the procedure, and that would translate at the end of the year into a significant amount of time being saved. So in terms of human resources, this is of great added value. So overall and in summary, I'm more and more convinced that the field can smoothly move into non-chemo based mobilization. In other words, we can abandon chemotherapy-based mobilization, because the cytokine-based mobilization is clearly proving highly effective, and the safety benefit ratio is highly positive.